Dzień dobry. So, I know I'm the last speaker, and I will not take the full 50 minutes, but just a warning. My goal this afternoon is actually just to inspire you. I can give you all kinds of amazing references and case studies, but today was actually quite impressive. I myself gained a lot, and thanks to Pavel for his translation, I was able to understand a lot was conveyed today. And so this is my opportunity to just give you some personal observations as a person who's actually worked in medicine. As you've read, I've worked in medicine, been very active, especially in surgery. I know that here in Silesia, or especially here in this area, this medical school has a long tradition in surgery. It's impressive. And I actually have a grounded background in ethnographic research. So I spend a lot of time traveling and a lot of time observing people getting frustrated with technology and talking with them and taking pictures. Of course, you can identify them. But for the past at least 10 years of my life, I've been traveling a lot, observing how people use technology and reflecting on that. And a lot of technology that we use in medicine, as I would say Professor West or Jonathan had mentioned earlier, it's confusing. And you can see here on the screen monitors to monitor vitals of patients. There's a lot of wasted space. And most of us here maybe can or cannot read this, but it's not intuitive. And actually, I've spent a lot of time actually as a patient. In fact, currently, I'm still a patient. And as a patient, I've done a lot of observations of the whole process and reflecting on this process of medicine and accessibility and usability from a patient perspective, from a practitioner, healthcare provider, and from an academic researcher has been fascinating. So I spent a lot of time with little things like this was some of the devices on the bed that I was in earlier. And I have 3 devices that I need to deal with just to either call the nurse or make the bed go up or turn on the television or make phone calls and things like this. I show this to you as an example of how even in the United States, one of the top hospitals, you're confronted and bombarded with so many different interfaces and ways of interacting. It's confusing. One of the doctors that I was working with as a patient, he and we got along very well, and I was wondering, he had an iPhone, which he would communicate with, but he wasn't allowed to use his iPhone or his iPad. He had to use this device here to communicate with other doctors. And if you look at it, it's just like from the 1990s. It actually looks like a little Nintendo game console you had as a kid. So how do we look at usability in healthcare? So basically what I want to do is give you some inspiration, looking at some hardware, looking at some software issues, and then give some design inspiration. And I have at least 3 or 4 videos. 2 or 3 of the videos are about 2 minutes apiece, and one is a 9-minute video. And the reason I share these videos with you, because they actually do a much better job than I can in explaining these things. So why is usability so important in healthcare? And back, if you saw the title of the talk, is how can this be used to save lives and actually improve healthcare? So let's look at some current usability issues. Medical errors. Yes, there are a lot of medical errors, and a lot of the errors are not just technological based, but actually human error. And the next video I will share with you comes from a consultancy in Canada, and watch this and be amazed. This was filmed in 2009, and it's the state of technology in hospitals, especially in North America in 2009.
Did that automatically delete everything I just programmed in?
Can you hear?
This is the most complicated thing I've ever seen.
This machine is a backbreaker. I just noticed. We need a chair.
They're just frustrated with the technology. They're talking about this.
Okay. All right.
Look at this, the way this program is developed.
Oh, this is crazy.
So, I'm so confused. Way too confusing.
A lot of the things that we interact with in medicine are confusing, complicated.
I don't know what's going on.
especially when it comes to infusion pumps.
Why isn't this opening?
Unbelievable. 50 items there and I've got to choose your own volume and I don't know where it is. I have no idea.
Okay, this is not very clear. Front. Oh, you have to put them on the front and back? No.
Oh, for God's sakes. That's why we need to get rid of them. See? This is bull. I don't, sorry.
That's okay. No, that's fine.
I find this is not user friendly at all.
I just wish I could edit here. I don't understand why this is so complicated.
I like this. This is for you, John.
I'm feeling so stupid.
That's dangerous.
Yeah, this is the current state of technology in 2009. And 2013 probably hasn't really improved. So yes, we can do better. And Healthcare Human Factors in Toronto put this together, and I think they did a great job. This is where I gained some of my inspiration, besides the Royal College of Arts now. That's my next one. So current usability issues. We have hardware, software issues. Let's look at some software issues. Now, as you know, in Western medicine, we rely a lot on medications for preventative medicine or cures. And we've actually found this is a study that I discovered, that medical usability, how to kill patients through bad design. There was the summary of a field study identified 22 ways that automated hospital systems can result in the wrong medication being dispensed to patients. And most of these flaws are classic usability problems that have been understood for decades. Now, why haven't we solved these issues? I don't know. But hopefully everyone here sitting here will be part of that solution in the future. There's been other research from JAMA, the Journal of the American Medical Association, of the role of computerized physician order entry systems in facilitating medication errors. So even when you create solutions, even these solutions can be complex and all this. So the University of Maryland, with Ben Schneiderman and Catherine Pléchon, they have come up with a solution. For instance, maybe a patient in a hospital has to take 5 or 6 different medications, but sometimes these medications can counteract each other or cause other problems. So this next video gives you a sort of a glimpse into a solution that can be used to reconcile medication. And I gained a lot of inspiration from this.
Here are the 2 lists I need to reconcile.
So these are all the
I click
medications.
Compare list and see the identical drugs move to the middle, the unique to the side, the similar align, and we compact everything. Let's do it again more slowly. So I start over and show the options so I can see each step individually. First, I find the identical drugs. They move to the center. Then the unique drugs will move to their respective sides. Intake to the left, hospital to the right. Then we align the similar drugs. Here you see acetaminophen, and we highlight what's different. Here, folic acid versus fulvite, which is essentially the same thing. The final step is to compact the display to save more space for long lists. Now we need to decide what to do with the drugs. Looking at the identical, I might select one of the drugs, so I click on it, or I might select them all at once using the menu. Then I look at the hospital unique and might decide to stop some of the drugs, so I use right click. But I can change my mind by clicking again, or I can reject all the remaining drugs. Then let's say that I accept the unique intake drug. Now I have to decide among similar drugs. So let's say I choose this one, and the other one is automatically rejected. For the folic acid, I'll choose the name of the patient is familiar with, fulvite. Now I'm done, I just need to confirm my choices. And voila, all the drugs are aligned, I can sign off.
That's just a simple solution. But there's other software problems. I think the most famous, how many of you have been following what's happening in the United States, the great country with so many amazing innovations? But for some reason, healthcare, especially access to healthcare, is still an issue. And healthcare.gov is the website which is sort of the, I guess, the poster child of poor usability. So for World Usability Day, we have a great case study here. Now, this was how it was launched. Of course, they've improved it now because they now give you 4 ways to access healthcare. And from what I've read, from the millions of people in the United States that don't have actually health insurance, only 100,000 people have actually been able to sign up. So there's definitely some issues here. And what I do have, there was some usability tests conducted. And I'm like, let me see if I can click through and show you one of these examples. So this is a tester online that was using the website.
Anyway, I cannot determine how much the plan is going to cost. And I don't know if this is some kind of stopgap measure to just pass some time so that they can say that they've had so many people on the site visiting the site, even though they won't say how many were successful. But thank goodness I didn't put in real information.
So this person is speaking out how they're using the site. And when you buy a plane ticket or a train ticket or even tickets to the movies, you kind of know what the price is beforehand or know what you're getting. One of the basic problems of this website, which many Americans are upset of, is they have to give a lot of their personal information out first, and then they find out the basic information that they're looking for. So that's what she's talking about.
Because this would be a screwball situation. This is not good. I'm not impressed. I would love to see what the pricing is on the different plans and what is covered.
Let me skip to the next study. Because what I wanted to highlight here is usability is very subjective. What might be usable for me or you is different. Obviously for this person, just basic information of finding out what their coverage is for them a usability issue. It doesn't necessarily have to be a technical issue. It's a perception.
Would be willing to come back to the site and get the real answers, but I don't think I'm going to get them today. And I think hopefully they're monitoring the site, and I don't know if the company that's doing this research is part of the whole healthcare.gov and just trying to get information on usability, but hopefully whoever will report and say this program is not real easy to figure out. I mean, the layout and all that stuff is real pretty, consistent, and looks professional. I don't see any typos or anything so far. But getting to the information that I need, trying to do the application, thinking that would somehow unlock all of the information, that was not easy.
Yeah. So things can look pretty, but it doesn't necessarily mean that it's usable. So let me go back here. See if I can start where I was. Yes. Excellent. But from the issues that have drawn out of healthcare.gov, there's actually, I think it was actually 2 days ago, this was streamed live online. There was a congressional hearing about oversight for this. So basically, this is probably a historic moment. How many of you are designers or developers here in the audience? Okay, imagine if the Polish government put you on trial because you launched a website which had problems. This is basically what this is. And Todd Park, who's like the hero, ultimate geek, he's the CTO of the United States. So he's Obama's geek boy who helps launch his websites. So he's on the hot seat. And there's been a lot of testimony. And basically, according to Karen S. Evans, she was the former administrator of electronic government and also Information Technology Office Management Budget. She says that from her perspective, the problems here are typical IT project failures. But it's almost as if people are placing the blame on policymakers and not looking at usability as the main issue. And as what Wojciech and Agnieszka had mentioned earlier, there is guidelines out there. Why didn't the developers of that website use these guidelines? And just referencing the FDA, and then you had the one document you were talking about, guidance for mobile apps. All of these videos and references I've already tweeted. So if you look for my hashtag, you'll have a link and you get that. So now let's look at some hardware usability issues. And the next video that I'd like to show you is actually from Professor Harold Twimbleby from Swansea. I don't know if you're familiar with him, Jonathan. He's working with human-computer interaction, specifically in medicine, and he's done a lot of thoughtful research in actual usability issues in medicine. Now, this particular video is about 9 minutes, but I think it's worth watching the whole thing because he brings up 3 main points about usability. One of the main points he brings up is that sometimes communication issues, signage, we talked about today, can actually be a huge usability, even an accessibility issue, but also looking at how medication is being administered with pumps and how you calculate medications. A lot of nurses rely on using calculators to dose medications. So a lot of human error is introduced into medicine because we rely on too many technologies. So sit back, gain inspiration from Professor Twimbleby, and that's it. 1 second.
Let's go to the beach, and it's a lovely day, and there are people playing. Just suppose some of them got into difficulties. You'd want to call the Coast Guard to get the help you need. I've got a mobile phone. We tend to think our mobile phones are wonderful. Technology is wonderful. What's interesting is I chose this and I like it, but very often we have to use devices we can't choose. Well, let's try and call the Coast Guard. Maybe you don't have coverage on your mobile phone, so you're going to run to use the Coast Guard phone. The Coast Guard phone, you can see on the sign, it's saying call 999. 999 is the right number to call to get the Coast Guard. It says 123. How are we going to dial 999? That's guaranteed we're going to take longer. I'm confused, I don't know what to do. I can't dial 999. I was told to dial 999. What do I do? Well, there's a really interesting thing going on here, that somehow the Coast Guard has put a 999 phone on the beach for everybody to use, and you can't do that. Something's gone wrong with the design. Here, it's really obvious that it's gone wrong. Possibly the Coast Guard don't notice because, of course, the only people who ring them up have succeeded in using it, and they're not going to say, oh, there's a design issue here. They're going to say, come and rescue the kids who are drowning. So it's an obvious design problem, but nobody knows about it. In hospitals, everybody makes slips. And obviously what's good about hospitals is everybody's professional and those slips get sorted out. What worries me is people make slips and the technology isn't part of the team that stops those slips turning into catastrophes. And the cash machine is a really good example of how the catastrophe of losing your cash card is a problem that's been fixed by redesigning the cash machine so that you can't leave your card behind, because you don't leave it behind now, you want your money. That is a good illustration of how redesigning infusion pumps and calculators and stuff like that would make hospitals a much safer place. Denise Melanson was a cancer patient who died from an overdose of fluorouracil. Fluorouracil is a chemotherapy drug, and you want to get the right amount of it, and it's really critical to get the right amount. If you have too little, it doesn't kill the cancer, and if you have too much, it kills the patient. And unfortunately, a mistake was made, and I want to explore what the mistake was. I'll tell you what the story is. Denise Melanson was called an ambulatory patient. She was walking around with this infusion pump and a bag of fluorouracil. So this is really nice. It means you can walk around, you're not stuck tied to a bed. Her bag of fluorouracil runs out and she goes to the Alberta Cancer Care Centre to get some more drug. And The nurses go to the pharmacy, they get another bag of fluorouracil, and they have to calculate how much fluorouracil the pump is going to give her. And it should have been 1.2 millilitres per hour. They accidentally forgot to divide by the number of hours in a day, so they ended up with 28.8 mils per hour. Denise Mullinson should have come back 4 days later with an empty bag. Instead, she came back 4 hours later, and basically she'd been given an overdose of fluorouracil, and that killed her. What went wrong? There are several things that went wrong. One is the way the calculation was done. It's actually very difficult to do the drug dose calculation. And the best I can do is it takes 22 keystrokes on a calculator. If you make any slip while you're doing that calculation, you just get the wrong result. If you're using a calculator, the whole point of using a calculator is you don't know what the right result is. So if you make a slip and get the wrong result, you don't know. So here they made a slip, they forgot the 24 hours in a day. The calculator had no idea what they were doing, and it just gave them the wrong answer. The normal take on this is that the nurses should be trained to do the sum properly. My take on it is, why are they using a calculator that doesn't know what they're doing? It's easy enough to set up the device. These infusion pumps can do that sort of sum. And in fact, the bag of fluorouracil the nurses were given said 1.2 millilitres per hour on it. There's actually no need for them to do the calculation at all. But the point is, if they make a slip, and from time to time everybody will make a slip, the calculator doesn't help. This is the infusion pump that Denise Mullinson was using. The root cause analysis, the study of why she died, included a study of this pump. 5 nurses from the ward where she was treated were taken for 2 hours to study how to go through the same scenario that ended up killing Denise Mullinson. Basically, none of the 5 nurses they had in that 2-hour study could use this pump effectively. They had problems with it. One of the obvious problems is the decimal point is the same as the up arrow key, and that confuses nurses. The conclusion that the root cause analysis had is that the nurses need to be trained to use the pump. And that seems like an obvious comment to make, like, you've got these things, people ought to be able to use them. I'm interested in design, and the different issue is, why didn't the manufacturers do a 2-hour study with 5 nurses and find out that they're selling an infusion pump that people can't use? They could have redesigned it so that it was easier to use, and it only takes 5 nurses for 2 hours, and you discover all sorts of problems with it. Those problems should have been fixed before it was sold. I'm arguing that design can make things safer. There are 2 sorts of infusion pump, and the question is, which design is better? There's one sort, like the pump I've just shown you, which has got a calculator keypad on it. If you want to enter a number like 12.3, you key in 1.2.3. You key in the digits. The other sort is an incremental keypad, whereas if you want 12.3, you press up and down, and you gradually increase the number to 10, 12, 12.3, or you decrease it from 100 down from 90, 80, 70 to 12.3. So one sort of infusion pump has up-down keys to increase or decrease a number. The other sort has got a keypad on it with 10 digits and a decimal point, and you type in the number that you want. Which is better? We've done some experiments, and it turns out that the up-down keypad is twice as good. And the reason for this is, if you're using a numeric keypad, you want to enter 12.3 or whatever the number is, you just press the keys. Your eyes are looking at the keypad. You don't look at the display because you know what you're doing. You look at the keypad because you need to know where to put your fingers. If you make a slip, you don't notice. With the up-down keypad, you don't hardly need to look at the up-down keys because you know where they are. You need to look at the number, and of course you keep on adjusting the number until it's right. And unsurprisingly, when you think of it like that, you end up with being more accurate and more reliable if you use the up-down keypad. So that's a simple example where an experiment tells you one sort of design is twice as good as the other sort of design in terms of error rate. The point is, if the technology is redesigned to detect errors, then everybody can do a much better job. At the moment, technology ignores errors, and it does anything. We've done some peer-reviewed papers that show that if you detect errors in this process, you can halve the death rate. I've given you a few examples of how bad design leads to problems. You know, from the Coast Guard phone on the beach to infusion pumps, calculators, up-down keypads. You can redesign things to make them safer and better support the tasks that people are doing. In healthcare, you've got IT systems and gadgets that are letting nurses and patients down. They're killing people and nurses are getting sacked rather than solving the design problem. I'm on a mission to get this message out, that everybody needs to be aware that the technology that we're using could be a lot better.
Yeah, this video emphasizes how many deaths actually occur also because of medical errors. Statistics are out there. Actually, it's quite alarming if you think about it. But I hope you got some information, inspiration from this as well. Usability. So let's look at some examples of designing for usability. So let me give you, how many of you here are actively working on projects which you are designing either software solutions or hardware? Any of you? Yeah. Do you find it difficult in terms of getting your ideas on, I mean, today you shared a lot of methods, but do you, what are some of the difficulties do you think you're facing with innovation? Budget. So deadlines, timelines, budgets. So it seems to be, these are external forces which influence, but it's not necessarily about your competence or whether the design itself. It's fascinating. Well, anyway, there's some students at the University of Cincinnati. They looked at the problem with pill bottles. In the United States, I don't know about here, pill bottles are sort of designed like this. They all kind of look the same. And when you look at it from an accessibility perspective, what if you're blind or have poor vision? Especially if you look at these, I guess these are called blister packs. They're mostly here in Europe. These are not necessarily easy to use if you have arthritis, elderly patients. And then you have these clamshell packs, which try to look at medication. It gives you the days in which you're supposed to take it. So this is kind of like a solution to the previous ones. But what if you redesigned medication bottles to have a certain texture or feel? And I think this is something worth looking into, and it's also inspiring. And also looking at the caps themselves having different textures and feels. Whether that works or not, I'm not sure. Some more design inspiration. We're moving towards paper health records to more digital health records. I don't know how things are here in Poland. I don't know if you're still working with paper mostly. Yeah. Well, the whole world is still in paper mode. But when you introduce electronic health records, then you're also introducing a whole new set of issues and problems, especially when this is one example of a health record, but still it's not very easy to read. But it's more visual. And then, of course, there are advantages and disadvantages to health records. This is looking at some, maybe in a developed world, in a Western context. But imagine if you look at health records in lesser developed regions, how could you improve existing health records, which actually document maybe immunizations or care in developing worlds, and improve them? I know that the Bill and Melinda Gates, just last week I think it was, actually has a call for entries in a contest to help redesign health records for lesser developed areas. Other design inspiration, actually, I had this in the slide before. I thought this was a really great example of going through the whole design process and coming up with a solution which actually tackled a very common problem in hospitals when it comes to resuscitation. This is the rhesus cart. And then defibrillation. How many of you have actually seen someone or experienced someone having a heart attack? Yeah. And were you able to help the person, or? Again, it's not a very fair question. You do what you, but
I knew what to do, but yeah, I didn't use anything right then.
No, but actually most places, I know when you had the the UEFA Cup here recently in Poland, you have a lot of tourists coming in, and then of course when you have a lot of tourists, you have a certain standard of care and healthcare, and I'm sure a lot of these defibrillators were distributed throughout stadiums, because when you have a lot of people partying and drinking at football stadiums, their heart rate goes up, maybe they have a heart attack, you need to reset their heart. This is just an example that many people have never used these tools before, but these are intuitive enough to use. And this is something I encourage you to look in. There's plenty of videos online showing that. From a hardware perspective, looking at CT scanners or MRI scanners, these have been improved throughout the decades, from these sort of like caves where the whole body goes into areas which, for the experience of a patient, is more usable, so to speak, but also from the healthcare providers. These are shots of machines that I've been in personally. So I kind of people take pictures of cars and stuff. I take pictures of CAD scan machines. And one of them actually offered me the opportunity to stream music from Spotify. So that was one innovation that I really much appreciated. But from a hardware perspective, also think of little things like toilets. Especially designing toilets can actually really save lives in terms of personal hygiene and public health. So you don't always have to think of healthcare and medicine from Western standards, but basic, simple toilet designs. You can call it flat design. Flat design, yeah, that's a good idea. Truly. But we can go from flat to, let's say, chic. Everyone talks about Google Glass. For me, it's one of the most amazing marketing concepts. Whether the use cases for glass are very practical or not, that's for each individual to decide. But this next video was a cooperation with Philips Healthcare and Accenture. It's not that I'm promoting them, it's just I got the video from them. And I think this gives you a clear example of where design is going in terms of usability with devices such as the glass. And I think this is something I wanted to share because I see this as a future scenario. Again, this is just the next is just a use case. It's not a real scenario, but it's a thought out use case. Can you hear?
Okay, glass, patient status. Okay, glass, check vital signs, bed 4. Okay, glass, increased SIVO, 2%. Very cool. I've been reading about it. I wanted to see what it was all about, and it was even better than I thought it would be.
At Philips, we believe that the future of healthcare requires innovations that can really make a difference.
At Accenture Technology Labs, we work with companies like Philips and Google to make these digital connections happen smoothly and quickly.
What makes Accenture our perfect partner is our collaboration allows us to build custom features for innovative digital technology like Google Glass that works seamlessly with our medical solutions.
To be able to use a wearable display in a medical setting to give doctors the chance to operate or coordinate with their peers in a hands-free environment is just not anything we've seen before. This is what digital transformation is all about.
For example, a young patient comes into the hospital with severe abdominal pains. Let's see what Google Glass can do.
I'm going to go check on the patient status. Okay, glass, patient status. Looks like he's in OR6, ready in about 12 minutes. Perfect. As the new healthcare information technologies start emerging, and they'll start being able to track patients, and having this sort of technology tethered to it would be very nice. Hey, Rob, almost ready? Yeah. Okay, I'm going to check on the patient's status, see if they're in the holding area. Great. Okay, glass, check vital signs, bed 4. If you have to turn away to look at the monitor, it makes it a little bit more difficult. If someone is that critical that you have to keep on looking, it's nice with one glance you can find that information again.
Philips and Accenture envision this innovation providing many opportunities to support the complex tasks of healthcare professionals, both in the operating room and beyond.
Okay, glass, record picture in EHR.
We really did it. We were able to develop the connection from Google Glass to our IntelliView solution to show data inside Google Glass.
Okay, glass, take a note.
Our goal is to continue to explore other uses of Google Glass in combination with our medical solutions to empower healthcare providers with seamless delivery of information.
At first it's going to be cool, and I think as everything develops it's going to be very practical. It's a great stepping stone. I think that will help make the care of patients go a little bit smoother and our jobs a little bit easier.
Yeah, but again, this is also still very technology centric. So let's make this a little bit more practical. What can you do? I know many of you are working, engage your clients. You're working with your clients. I know you have certain restrictions, budgets or timelines, a lot of external forces on you, but empathize. I think one of the things I gain inspiration also from is IDEO. They are really pushing forward a lot of interesting design concepts such as empathic design. And this has inspired me to look at usability as sort of like a service to humanity. If there's nothing more frustrating is to either use a product or service which doesn't really fit your needs. So when you look at Millennium Development Goals, how many of you are familiar with the development goals? It's a couple here. One's to improve like mental health, ensure environmental sustainability. But what if one of them was to improve usability? So if that's one of the inspirations I want to bring to you today is how can you go from this conference here in Poland and just like you did with the fall of communism, maybe take usability as a revolutionary. And there are people like Bill Gates who actually will support you. He really believes that every life is valuable and that we can make things better, that innovation is the key to a bright future. Now, innovation is sort of this Trojan horse, technology or innovation. But we all know that we're just getting started. So trust your design sensibilities. Most people respect the design sensibilities of, say, Steve Jobs or Paul Rand. And there are many other people we respect. Paul Rand, are you familiar with Paul Rand? He's a graphic designer. Graphic designers, you know who he is. These are some of the logos that he worked on. In an interview, I think it was in the 70s, he really sort of encapsulated what the role of the designer is. It's not that the designer is so important, but the designer can actually have a huge influence on society. So I wanted to play this quickly. This is only a minute. Paul Rand's view of the role of designer, especially graphic designers.
After thinking about the subject for so many years, that we're not as unimportant as we think we are. Because, first of all, things that look good are important for our environment. You know, I mean, it's better for things to look good than to look bad. Because the problem there is, it depends on whose opinion you're seeking. But I think the value of a designer, for example, to a businessman is that he can add a great deal of value to his product, to the businessman's product. And I don't think that businessmen really understand this. He can improve the quality by making it look better. And very often the designers have ideas that not only improve the appearance of the product, but also improve the product itself. I mean, this of course is truer in industrial design than it is in graphic design. But a designer is a good designer who understands his business, can make things memorable, make them easy to recall, which is very important, and improve the general quality of life, which is the only reason for our existence.
We can apply that to anything. It doesn't matter if you're a designer. What is your purpose and how can you improve life? So what can you do? I know there are not too many famous Poles that I know of. And coming here, I was really grateful that I was invited here to speak with you all. And I gained a lot of inspiration also from Daniel Libeskind. I mean, he's, as you know, a tremendous architect. Working now on the World Trade Center, which is actually almost completed. But you also have one of the most famous Silesian residents, Copernicus. And Copernicus purported that not everything rotated around the Earth, but it was the heliocentric design. So how can you take, let's say, the ideas of Copernicus and apply it to design and usability? What is the center? Is it the person? Or is it the technology? This is for you to sort of come away from this conference and come about. So maybe you can revolutionize the world of usability in that sense. Those were thoughts that came to me. So how can design save lives is up to you. There's many examples I've given you, some inspiration, and I just thank you for this time, and dziękuję. If there's any questions. I was, it's between me and the rugby players, and they were scary on their wheelchairs. So which is the center? Is it the user or is it technology? What was your question?
Because everything up to the point where Google glasses were shown was once I saw the guy with Google glasses, I was wondering, well, facial recognition seems to be kind of prone to error. And especially when it comes to something as important as medicine and patient statistics, I was wondering, did they test how prone to error the facial recognition devices?
So the gentleman was discussing up into demonstrating Google Glass. Google Glass gave him a lot of doubts how error could be introduced by wearing glass. I think if that's how I understood your question. Yeah. Again, this was not a real scenario. This was a use case proof of concept. And if you remember, I see glass as one of the best marketing campaigns ever. And if it's practical in medicine, actually, I do see some use cases which are very practical. It might not be how you saw it here, but one would be, if you're familiar with Google Glass, you can actually record things from the perspective of the user, of the person. So if I'm, whether I'm a patient or a physician, and recording what I'm doing, if I'm doing surgery and recording it and then sharing that with my colleagues, I could be in a surgical theater here in, how do you say the name of the city? It's hard to say. Zabrze, yeah. And I wanted to consult with someone in Warsaw. You could do that. That's a very practical use case. Now, what this physician was doing is actually just getting information, communicating. He's looking at vital signs or checking on a patient. Now, if he uses this information to make a decision, this is where errors can come in. Maybe he's getting the data from the wrong patient.
Yeah, that was exactly what I was thinking.
Yeah, so it's a discussion piece, as Jonathan mentioned earlier. It's not that all these design use cases are foolproof or error-proof, but it's to get us to discuss.
Okay, thank you. One more question.
Thank you. Well, I know how to phrase this question. It's just a thought that I'd like you to elaborate on. You mentioned that inspiring ourselves is important in this field. And I'm just thinking, healthcare is a place where we can actually do harm by creating bad designs, right?
Yes.
So, do you think, this is something inhibiting our creativity? It doesn't really make us brainstorm all the crazy ideas.
Yes.
Doesn't make anyone do it. And I'm just thinking, a trial. You mentioned a trial to try a designer for doing a bad thing.
Yes.
I mean, apart from the fact that healthcare.gov is a failure, it's mostly a programmatical failure, and making designers pay for bad design isn't maybe the best way to go.
So, how can you, if I was to inspire you and you want to take these risks, I guess the question I understand is, what would motivate you to do this still?
Yeah, I'm thinking like, what can make people kind of let go of the fear?
Yes, because I know there's a lot of lawyers in the world who just wait for you to make a mistake. There's a business model behind that. The way I look at it, how many people here have cats or dogs at home? But we can actually test out a lot of these concepts on animals. I mean, that might not be the ideal, but that's one way to minimize risk. Or we have simulations. We could simulate in Second Life or avatars, things like this. But there's going to be a point where we have to design to progress. asking questions, do we really need this, or is technology really the solution, is probably the important way. But back to empathic design I mentioned, you have to put yourself in the shoes or in the eyes of a nurse or a doctor or a patient. And I've been in all those shoes. I was a nurse. I was a patient. And luckily, I'm able to reflect on this and actually help others now. This is what I'm doing. So if you feel by making a mistake is keeping you back, then you won't progress or do anything. But I would just encourage you, if you have any crazy idea, just at least pursue it.
Thank you.
Yeah. I think I was doing some research coming here. This is the first time I've been in Poland. And there's a lot of amazing innovation from here. I think one of the first space rovers that was actually developed was from Poland. So I don't think they worried about that. They did it. Yeah.
Okay, here is one more question. Please, Robert.
We have the wheelchair rugby players waiting for us.
All right. So just a quick one. It's just to continue the topic. Doesn't taking responsibility by the designer for making a bad design makes him less creative in his next designs? Because it's very easy to show in world of healthcare that many things do not require changes. They require a simple revolution. So doesn't such responsibility for the designer makes the changes slower?
Maybe that's true. Maybe that's why we experience what we're experiencing currently. There's a lot of incredible ideas in the world which are not being implemented because whether it's budgetary issues, timelines, or the fact that people are afraid to get sued. I don't necessarily have the answer, but I think by having conferences like this, discussing it and reflecting on this brings us a step closer. I mean, there must be something about this to have you all come here on a Saturday all day to reflect on this. So there is an interest.
Yes, there is.
And designers are not the only people. I just think I'm coming from a design perspective because I think design has a huge impact on our world. I mean, I bet everyone here has a smartphone. And maybe 10 years ago, it was a Nokia. Whoa. It's also smart. But what's going to happen 10 years from now? Hopefully 10 years from now, we don't have phones in our pockets. Hopefully 10 years from now, we're able to get the information we need wherever we are or communicate with whoever we need to without necessarily thinking about the tools you're using. Again, technology is something that helps augment humanity and brings us forward, but it's not the only thing. We have to work with each other. I think that's it.
Okay, thanks. Are there any questions? Or I think there are no more questions. Thank you.